scary places. And that's even though we know medical professionals are just trying to help us. So to bring this idea to the forefront, Intermountain Medical Center is starting a new initiative called Zero Harm. Here to tell us more about it is Moody Chisholm. He's the Regional VP of Intermountain Healthcare. Thanks for being here today.
Sure, my pleasure.
And welcome to the state. You're a new Utahan from Florida.
Yes, ma'am. I am.
So we just found out, thanks to the U.S. News and World Report, they released their rankings on hospitals across the nation. Intermountain Medical Center, #1 for the state of Utah and the region. You must be proud of that.
We are, and I think it's a reflection of our vision that we want to be a model health system for the world and provide extraordinary care, superior service at an affordable cost. So I think that's a reflection of that.
And best practices seems to be a buzzword when you're walking around that campus there in Murray, trying to do the best practice for the patients. Why is that so important?
Right. We know that there are doctors treating some of the same illnesses across the country.
Yeah.
And so our doctors and all of our clinicians spend a lot of time researching what the best practices are that drive the best results for patients. And so I think that's one of the reasons that Intermountain stands out internationally as a superior clinically performing organization.
And with those best practices, I mean, that trickles down to the patient with your treatment not being misdiagnosed, having the proper care right away, and then it trickles down to cost as well.
Yes, ma'am. There's across the country, when mistakes are made in the hospitals, whether it's hospital-acquired infection or a misdiagnosis, that means longer stays in the hospital. It means more drugs, possible additional surgeries.
Yeah.
So reducing harm in the hospital that occurs in the hospital obviously reduces cost as well.
And that brings us to zero harm, a realistic goal that you're trying to achieve.
It is a really difficult goal because we have humans caring for humans.
Right.
And eliminating the mistakes of humans is obviously a difficult task, a tall task. So it requires that we work together as teams. And, you know, as you may know, back in the mid-'80s, a study was completed that suggested that there were 98,000 deaths per year because of mistakes in hospitals.
Wow, that number's too high.
It is, and those statistics were updated a few years ago. And now the estimate is between 220 and 440,000 deaths per year because of mistakes in hospitals. So it has to be a big focus of ours. It now is the 3rd leading cause of death in the United States.
Oh, you just don't want to hear that. Right.
So we're very focused on eliminating those mistakes. And already, thankfully, Intermountain performs very well, beyond much better than the national average. And yet, our only moral goal is to completely eliminate mistakes that harm patients.
And is this a conversation that you're having with staff from top to bottom to make sure this happens?
Yes, ma'am. All of our physicians, we're investing millions of dollars to make sure that every single employee, whether you're filing folders, cleaning the floor, or whether you're doing open heart surgery, every single physician, every single caregiver, every single employee is getting extensive training in the protocols and the processes that eliminate the chance of mistakes getting to the patient.
Got it. So we'll cut it off at the very beginning so it doesn't trickle down to the patient so we don't feel that. Moody, thank you so much for joining us. We'll put all those details about zero harm on the new Intermountain Medical Center website. There it is, a much sleeker concept. I like the new look. We'll put that on our website at goodforutah.com. Coming up, we'll tell you a reminder on how